Well, welcome to the presentation. My name is Travis Wilhelmsen. I am co-founder of the SmileWizard. Used to be called the Dawson Diagnostic Wizard, and we have a long history. I will not go into that now, but I understand, the ins and outs of the courses, etc. And it's been my privilege to become involved with the Dawson Academy and actually get to know Pete Dawson. And that really has been one of the greatest things of my life, and actually kind of led me to where I am today. Like many of you, when you go to the Dawson Academy or other academies, perhaps, everybody's got their own special path that they have trod. So super excited to be here. Grateful to be able to give this presentation. And we're going to be talking about Dr. Dawson, Atul Gawande, and we really want to talk about how important it is to do complete exams. That's kind of what we're going to dive into here today. And interestingly enough, even though we are going to be doing this presentation, you can watch it as many times as you want. If you actually watch this live, uh, you're actually going to retain about 10% of what you learn in about a week's time. And there was actually a doctor named Herman Ebbinghaus. Actually, he wasn't a doctor, he was a psychologist. And one of the things that he studied was memory and how much people learn and understand and how long it takes for people to forget certain things. And so I'm giving you this today, and in a week's time, you're not going to know much about it. And he actually came up with this equation that over time, this is how people start to forget things. So in the moment, you get it, you understand it, it's exciting, and you want to continue. But the problem is that you will forget this inevitably. And all of you probably have graduated. Because I think this is for the Alumni Association. You have graduated and from the Dawson Academy, and you're able to start to practice. Now, if what I said was true in the beginning, you're not going to retain but 10% of this even into next week. That makes me wonder how much of the curriculum do you understand and continue to use after the fact as well. And if I had to guess, this follows just like everything else. You're going to start to forget it, and it really kind of depends on what you decide to do after you hear the information. A lot of people will take notes. A lot of people start writing this stuff down immediately. But think about the investment that you've made in these courses and in the Dawson Academy. And I will 100% say they're worth every penny that you pay for these things. And that knowledge is so valuable. But are you protecting that investment is what I would ask. And in our daily lives, we have all kinds of stuff that happens to us, right? We have chaos in the office. We've got HR to deal with. We got these people coming in. They're not scheduling me correctly yet. We're not communicating correctly. The more stress that comes up between the time that you actually hear the information and you're learning from the information, the worse it gets. And so if we don't reinforce it, it will become lost. And so think about that for a minute and just, how much am I actually implementing the philosophies and the things that are taught in the Dawson Academy are pretty valuable, and we don't want to just let those go by the wayside. For example, if I brought up the one of the things that I always hear about in the courses is the phrase cow trapping. And everybody has a certain recognition maybe of that term and how it's used. But that's just one thing. Do you remember exactly what it means? Do you remember how the principles behind that work? If you don't, then you're just forgetting it. And maybe there's a very valuable lesson there that you should be practicing or understanding or using in your everyday life. Atul Gawande wrote a book called The Checklist Manifesto. And he basically studied checklists and the history of checklists in several different industries. And he realized and learned many lessons from this. But one of the things that he learned most well is that human fallibility exists. We are prone to be foul. We are prone to make mistakes. And a lot of times it's because we don't implement the things that we learn right away. Okay. Um, the volume and complexity of what we know has exceeded our individual ability to deliver its benefits correctly, safely, or reliably, is one of the things that it talks about. Um, he argues that human memory and attention are fallible, especially under pressure. Checklist acts as a cognitive scaffolding, ensuring the critical steps aren't missed, even by experts. So when he goes out and studied this, well, if you're not familiar with the book, I would highly recommend you read it and understand it because it's a very simple thing that was implemented. Atul Gawande is actually a doctor from Boston. I believe he's a surgeon. And he noticed a lot of things about these checklists. There was a doctor called Dr. Pronovost from Johns Hopkins University, and he realized that when putting in central lines, now central lines in the ICU is where you put a line into the vein, a very large vein typically, because in the ICU you have to get a lot of blood out, and you have to be able to, you know, grab blood, test it, and when they put in these central lines, a lot of issues and problems were happening. He came up with a simple checklist, and basically it was washing hands was on the checklist. You know, who's not who, nowadays we look at that and we think, gosh, that's incredible. This was in 2001. Wear a sterile gown, clean the insertion site with antiseptic, use sterile drapes, and avoid unnecessary line placement. So here we have this complex thing that's going on, but in the ICCU, it becomes mundane. This is just how they do it. But in attaching this checklist to it, they learned a lot of things from doing this. And the infection rates actually dropped from 11% to nearly zero. There was 1,500 lives saved and 100 million in costs avoided over 18 months. And the bottom line from that is they didn't realize what they weren't doing. They didn't have a checklist in place that said, oh, yeah, this step one, step two, step three. And it proved that even elite professionals will benefit from structured systems. And that was kind of proven out over this book. And I would, again, I would highly recommend you read this book. One of the main things that they talk about is there's a hidden cost of overconfidence. The doctor, as in an operatory, not an operatory, but an operating room, an OR, where the doctor is going to perform these complex systems. They realize so Dr. Pronovost took this out to the masses. He thought it was so important and something so simple to do, but he found that there was a lot of opposition to it. And I want to quote this part of the book because this is something that he also learns from doing this. We don't like checklists. They can be painstaking. They're not much fun, but I don't think the issue here is mere laziness. In other words, we're not doing it because we're lazy, right? We're not doing it for another reason. There's something deeper, more visceral going on. It somehow feels beneath us to use a checklist, an embarrassment. It runs counter to deeply held beliefs about how the truly great among us handle situations of high stakes and complexity. The truly great are daring. They improvise. They do not have protocols and checklists. Well, maybe our idea of heroism needs updating. In other words, maybe we're a little bit too prideful to use checklists. Maybe we feel like we don't need checklists. But from studying this book and from listening to it, it becomes obvious that this is something that we need to pay attention to. Uh, we don't fail because we don't know. We fail because we forget. And I would even say we fail because we choose not to adhere to a structured system. We tend to let go of those things and we tend to use our own intuition, for example. And I think this is one of the main things. And I think that this book was actually published after Pete Dawson sort of came up with his philosophy, right? Pete's philosophy was mastery through structure. If we can build the structure around us that will help us not miss steps, and with we combine that with our own intuition, the things that we've perhaps learned in school, that is where true excellence comes from. So let's talk about the masticatory system, the complete masticatory system. And I think this is one of the reasons why Pete Dawson was so effective, is that through his life, he was a student all the time. He was always learning and he was always trying to understand these things. And he would always help dentists sort of level up their thinking. Now, the book talks about complex systems. It talks about raising, an 11-story building. It talks about pilots. It talks about how the aviation industry has been completely transformed by these, and we start to understand that any discipline is going to have higher thinking when these two things are combined. So intuition and systematic thinking, right? Dr. Dawson is famous for saying intuition without structure leads to inconsistency, and you have to have both. And I would say that the things that we've learned in the Dawson Academy, they will absolutely transform your dentistry and help you to be the best dentist that you could be. The structure is the checklist. And in the Dawson Academy, I believe it's in Core 3 now, that they give you the 2D checklist and the 3D checklist on paper. And that's all fine and good. If that is followed and that is adhered to religiously, that is where you will have great success in your dentistry. And so that's a very important concept. And it's something that we learn from the book as well, and through Pete Dawson. I had a conversation at one point with a guy from Dental Intelligence, and he was explaining to me what their software does. And if you know about them, you know kind of what it does, right? They allow you to get patients in the door that have perhaps not scheduled treatment. It goes in to your data, your fishing pond, so to speak. And let's say your patients are the fish, it allows you to get those get those fish. If somebody cancels on Friday, I can go in and I can actually look up, well, where's my, in my whole book of business, I can, well, who would be possible, who is a good candidate that I can start to call, who would come in on a Friday afternoon, and it almost works kind of like magic, but it's mining that data, right? It's mining the fish that are in your pond. And so you can think of SmileWizard not as the piece that helps you fish the pond or to get those fish back into the office, so to speak. SmileWizard actually helps, it's almost acts like a sluice gate. And so as you lower the sluice gate, more water can come into your pond, more fish can come into your pond. But if you lower it lower and you go deeper, the more fish that are going to come into your pond. There's some fish that are very deep. And if you want to catch the big fish, you have to pay attention to what you're doing with complete exams. And you have to be able to talk about the things that you should be talking about. I just talked to a dentist the other day about this product, and he said, you know what? That is something that is missing from my repertoire. I never ask if they like their smile. I rarely have discussions about things that they possibly want to change about their smile. And I said, you're leaving a lot of conversations, meaning a lot of dental work off the table because you're not even talking about it. And so, we need to get back to asking all of these things. Kind of one of the things, and this is actually I told Gawande, he says checklists instill discipline for higher performance. Again, another takeaway from the book that is extremely important. So let's talk about for a second these checklists. And even Dawson trained dentists struggle with consistency. And it's very easy to rely on your own knowledge, rely on your own intuition, rely on what you've learned. I want to practice dentist this way. And therefore, why would I need a checklist? I'm doing the things, right? But what we find is even Dawson trained dentists will struggle with consistency because it's a it's a complete philosophy. Uh, and sticking to the basics is where it's at. So I wanted to talk really quickly about Scotty Scheffler. If you're a golfer, you know who Scotty Scheffler is. Scotty Scheffler is the number one golfer in the world right now. He's being um, talked about. He's being compared to Tiger Woods, and they're doing some of the sort of similar things in their careers already. But he's just an amazingly consistent golfer, and that's his profession. Pro golfers consistently emphasize that talent may open the door, but consistency is what keeps you in the room. Across interviews, swing breakdowns, and practice routines, the message is clear. The best players aren't always the most naturally gifted. They're the ones who can repeat excellence under pressure. So we all have this. We all have real world pressures pressing down on us. And again, it doesn't matter the discipline or the line of work that you do. Dentistry is just one of those lines of work that happens to be very, very fulfilling. I'm not a dentist, but I talk to a lot of them. I am a professional patient. I do play a little bit of golf, and I know how hard it is to do these things. And the point I want to make is that consistency is not a skill, is a skill. It's not a trait. In other words, you learn consistency by doing the things and staying consistent to the skills that you're practicing. It's not a trait, it's not a given, right? Scotty's team is very known for focusing on repeatable mechanics and tempo, not flashy shots. His team engineers a routine to minimize variability, proving that consistency is cultivated, not inherited. If any of you play golf, you know how hard it is. You stand up to the ball on the driving range and you try thing after thing after thing, and it gets a little bit annoying sometimes. You can go out on the golf course and you can just hit shots that are unbelievable, and you think, yes, it worked, and then your next shot, goes off to the left or to the right, and you have absolutely no idea what you just did and why you did it. But this is a great thing to realize. Okay, consistency is a skill. You learn consistency, and it's by showing up and doing the things and practicing the skills, and you're building this structure around you. And that is definitely a way to greatness. Scotty is number one golfer in the world, right? So I was on a trip and I was away from my home area. I think I was traveling out east somewhere. The flight was late. I think I was trying to get home, and I happened to be sitting in a place that was just across the barrier from a couple of pilots, and I could tell that they were waiting to get on my flight and steer this plane, whatever, back, wherever we were headed, probably back to Salt Lake City or something. But they were sitting there talking to each other, and the more senior one all of a sudden leaned over to the junior and he said, "Hey, I realize that we need to get out of here. I realize that, you know, this isn't going to be a quick turnaround. What do you say we skip the pre-flight checklist and we get out of here a little early and, so that we can get home a little sooner?" I want you to imagine yourself in that situation. You just heard the senior pilot say, "Let's skip the pre-flight checklist." What do you do? Let's say change the scenario a little bit. Let's say it's not me standing there, you're sitting there, and your daughter's about to get on that plane. I would hope in that situation that you would say something. Now, full disclosure, this didn't really happen to me, but it puts me in a situation where if they were going to do that and I'm on that next flight, what am I going to do? I've flown in small Cessna airplanes, anything from that up to a 747, and a lot of times it's pretty scary, right? There's no way I think I would get on that airplane, and I would hope that I would say something because this is important. We know that those pre-flight checklists are important. I don't think there's any. I don't think there's any buddy that would want to do that, would want to fly on that, right? So even trained professionals are tempted to skip steps. And just because dentistry is not mission critical, it actually is mission critical. And me as a professional patient, I've got my own stories. I've got my own journey through dentistry and the dentists that I've had. And, some of them I didn't necessarily respect, and some of them I didn't necessarily trust. Now I've had a lot of great dentists as well, so that is good. Um, but this structure is what reinforces the Dawson standards without adding friction. It will help you do a complete exam. It will help you dig deep. Um, Diagnosis precedes design. This is something that Dr. Dawson said a lot. Skipping the complete exam is like building a house without surveying the land. It might look fine at first, but it won't stand the test of time. I can't imagine doing that. Um, and so I think there's another thing that he said actually that was I can't remember the quote exactly, um, but he talked about this all the time. I mean, the fastest way or the shortest, the longest distance between two places is a shortcut. I think I butchered that a little bit, but I've heard that a lot in the classes too. I mean, people understand that if you're taking shortcuts, number one, you're not going to learn from it. You're not going to learn from the repetition of it. You're not going to dig as deep, and it just sometimes isn't going to work necessarily. And that's how back to the analogy of the pond and the fish. You've got to do these exams so that you don't miss anything. This is how dentistry becomes predictable, is through the complete exam, through taking the time and making it work and making sure that you're not skipping steps. So, one of the things I wanted to do on this meeting was to introduce the complete exam quality metric. This is an easy way for you to know and understand how you're doing, how are my exams going? Am I getting people in, and am I doing complete exams, and am I tracking it like I should be? This here is this QR code you can scan, and you can go and fill out I'm going to show you here in a second, but you can go in and fill out a quick form and download, or actually once you fill it out, it'll actually send you what I'm about to show you. So if you can scan this code, go there and quickly fill it out. And I'm going to show it here live so that you can see what it's going. But really what it is it's a way for you to test yourself. Am I doing what I should be doing? And really this comes from the SmileWizard. The SmileWizard is the checklist uh, for the Dawson Academy. And so I would encourage you to go do that, fill this out, and find it. Now, this is how it starts out. This is the complete exam quality metric self-assessment tool. Basically, you would just put your name and your date in there. And the date is important because why? Because you're gonna take this and you're gonna say, how am I doing? And later you may learn some things, and the intent of this is just to say, okay, I've learned something from this. These are the things I'm doing. These are the things I'm not doing as well. But if I evaluate myself, there's going to be a time when I can, down the road, I can do it again. And I can take this, I can fill it out and say, hey, I've gotten better. And that's really what it's for. And so go ahead and download this. You can fill it out. And some of these questions are, uh, do you record whether the patient is a side or a back sleeper? Do you record which teeth are mobile? Do you analyze the Ricketts E-plane? In other words, the profile of your patient. Do you record whether the patient has their tonsils? Do you document parafunctional habits? Do you use bilateral manipulation? Actually, I think that's supposed to say bimanual manipulation to inspect the joints. I'll get that corrected. Do you record radiographic bone loss? I don't want to go through all of them here on this, but this is a way that you can go in and see that. Just a couple more here. Do you record whether the patient has frequent headaches? Are you familiar with stop bang, and do you record the results of that? Do you record where the first point of contact is? Some of these have to do with occlusion. Some of them have to do with other things. And then once you get down here to the end, there's this, you saw that the questions, they'll have an A, an O, or a T, or an E. And these are the four main areas that SmileWizard helps you go through. You score yourself, and then you can understand maybe what it is that you're doing. And then a little lower down here, you can, for a deeper dive, you can group your scores into these categories. This is how well you're doing with airway and sleep out of 40. This is occlusion and function. How are you doing out of a possible 55 points? TMJ and muscle. And some of these, if you end up having a 0 on them, that you're going to learn something. And as you go through all of these, you can score yourself against both of these. But here's the intent is that once you go through this and you understand perhaps maybe what I'm not doing, where, or maybe I'm not doing it enough, you can say, okay, I need to change. Based on your thoughts, what is your action plan? This is going to invoke something inside of you that's like, okay, if this is what a complete exam looks like, maybe I can do better in this area or that area. I was at a class last year, I think it was core 3, and there was a group of dentists sitting around the table. And I said, how many of you ever did a complete exam in dental school? And there was probably about 20, no, there was probably about 15 dentists sitting around the tables. And the answer was 0. Not one of them had ever done a complete exam in dental school. It's not what dentists are taught in dental school, right? And so it takes something like a Dawson Academy, other academy, to do this training, and then you will understand it. And even when you start out your practice, and you start to learn about things like this from the academy, it's going to solidify, oh yeah, I need to be doing this. I need to be doing that. And this is what you should write down here. What's my action plan to do better? Am I including everything in my exams? If I'm not, how am I going to change? Am I going to go to, I'll tell you what, though, if you use the Dawson Academy's 2D and 3D checklist, even if it's on paper, you're going to be doing a lot better than people who don't have that. And you're going to be more consistent than people that don't have that outside of the SmileWizard. But come up with an action plan, you know, put some things out there that you're going to do, that you're going to put in place, etc. You know, I found that the Levin group also has a very good idea of why this is so important. One of their quotes is the comprehensive exam is the most important appointment in the practice. It sets the tone for everything that follows. If you have a baseline with your patients, they're going to know that. Other rather than the dentist who comes in and just is like, well, no cavities, I'll see you next week, or I'll see you next month or next year or next 6 months or whatever. You know, it's if you're going to have more conversations about deeper dentistry and bigger dentistry, bigger fish in your pond than you have in, practicing up to that point. And you'll start to realize that it's coming in. It's interesting to hear the stories from those who have, from the faculty of the Dawson Academy, great people and great dentists, who understand and get these principles that Pete Dawson taught. And it's also very important to know that this is not a scorecard. This is a mirror, and you can basically score yourself against Dr. Dawson. If there is a gold standard in dentistry, it is Dr. Dawson. We should be doing those things that he did. We should aspire to try and be a dentist like Pete Dawson. And all of these principles and everything really kind of come from him in the first place. And so back to SmileWizard, bringing structure and consistency to your practice. This really is a checklist for clinical excellence. Whether you use the paper copies or the SmileWizard, it just works. It just gives you the best treatment plans that you could come out with. It's a great communication tool as well, and you can use that to talk to your lab techs, your perio, your kind of your dental network. Um, we are actually coming out. I'm going to skip down to the new functionality. We are just releasing probably this next week the ability to quickly send all of your images, the patient images, the notes, and the diagnosis to clinicians, or basically your network, with the click of a button. You'll be able to, if you're familiar with this SmileWizard, you go in and you have every patient on it lined out. You can click on a little button that says, I want to share this case with somebody else. And with the click of a button, you can fill out their email address and you can send that case off. So there's nothing to download. There's no big PDF to try to send over mail, or try to email it to somebody. It is the SmileWizard, and it has inside of there the things that your lab technician would want. Okay. And to be honest, we haven't even told the lab techs about this yet. And so I think they're going to be pretty excited about this, because it will give you automatically, you'll be able to have, the lab tech will have what they need. And if you need any more conversation about that, a quick phone call, and you're on the same page and everybody's kind of looking for it. But it really does guide you through structured exams without replacing judgment. Again, being a dentist is your area. You are becoming a physician of the complete masticatory system. When you think about the complete masticatory system, you think, well, how do the pterygoids, how do the masseters affect my bite and affect this complex system that's going on, that is my mouth. It is complex. And, another thing Pete Dawson used to say is, we are becoming physicians of the complete masticatory system, because that's how we look at things. It's complex. If I'm just looking, tooth by tooth to get an idea if there's any caries, you're kind of missing the point, right? It's how everything interacts and works together that needs to be understood in order to have a completely healthy mouth. Okay. So, and again, the SmileWizard does not do the exam for you. It just helps you do it like you intend to, especially knowing and understanding the Dawson principles. And so Again, elevating dentistry. This is how you do it. This is how you sort of practice. This is, back to the Scotty Scheffler analogy. This is the way to structure your dentistry for success and for the best possible outcomes that you can do. And so I would encourage you to do several things. Adopt a checklist, whether it's a paper checklist or a digital checklist. Download the complete exam quality metric tool and see how you're doing. Evaluate yourself. Kind of put that stuff together, and I'm going to do better, right? You can sign up for a trial of the Smile Wizard at smilewizard.io. You can follow up with me, Travis, at lifecycledev.com. The company is actually called Lifecycle Development. Uh, Call our support line so that you can schedule a demo, or we could just have a discussion about it. I'm thinking about putting office hours in place so that anybody can call me up at any time, not any time, during office hours, so that you can get help with it. And you know, it's a lot like the Dawson courses, but it enforces all of the things that you have learned in these courses. And that's the power of it. That's the beauty of it. Um, Follow up on your action items from the quality metric, and I would say again, practice. Don't forget it all. Once again, you're not going to come up. You're not going to, be a week from now. You're going to say, I remember, them talking about this, but I don't remember exactly what to do. Well, listen to this again. I think this is going to be available to all the Dawson Academy graduates. So, I would very much encourage you to do that. But, don't let it go by the wayside. You have to put it in practice. And if you sign up for a demo or something and you want more help, please give me a call. I understand that it's difficult. We're trying to do the things that are going to help you continue to use it, but it's kind of a discipline. You have to go out to the practice range. You got to start hitting um, fades, and you have to start hitting, shots that you're gonna be able to, so you can control the ball on the golf course, basically, so you can catch the big fish, etc. And I would say Dawson gave us the philosophy, Gawande gave us the method, and Smile Wizard gives us the tool. This is actually a picture of a place. It's Punch Bowl Falls. If you're familiar with hiking in the Columbia Gorge, which I would completely recommend as well, hiking in the Columbia Gorge is absolutely gorgeous, and especially during the summer, obviously, because the rest of the time it's kind of raining there. But um, this is a beautiful place. It's called Punch Bowl Falls. It's on the way up to Angel's Rest. I've swam in this little, creek several times. I've taken my boots off and soaked them in this water, and it is absolutely, the water is always cool and cold. So you've been hiking on your feet. And this is kind of the image that I think this elevates to us. This is the same feeling I get when I help dentists become better, become more elite in doing and practicing the disciplines like the complete exam that are going to give them the best option. Dentistry becomes fun. I think the reason that Dr. Dawson succeeded so much was because he was disciplined. He had a curiosity, and he was a learner, and he realized a lot of this stuff before the rest of the industry did. And so I highly recommend that. Highly recommend thinking about this and doing these things. And with that, I'm going to go ahead and close the presentation.